Welcome to Tim's TV. We are here with Senator Jenson from the state of Minnesota. He's also a doctor who had false ethical allegations against him because A, he's a Republican, and he told the truth about hydroxychloroquine's safety. Senator.
Thank you, Tim. Essentially, on April 3rd, 2020, I received a communication from the Minnesota Department of Health providing information and advice as to how to complete a death certificate in the context of the COVID-19 pandemic. I've never received something like this before in regards to any flu epidemics or the 2009 swine flu epidemic or the 2018 epidemic where some 80,000 Americans were, if you will, killed by the influenza virus. So anyway, I looked at this document and I said, this isn't right. We don't put as the underlying cause of death something that we assumed or thought was probable or suspected. And in the information from the Department of Health, it indicated that if COVID-19 was thought to contribute, that should be used as a cause of death. But if things like emphysema or asthma were thought to contribute, we should go ahead and put that in Part 2 of the death certificate, which is where we have always put contributing conditions in Part 2. The all-important thing is the underlying cause of death, and we were basically being coached. So I ended up making a statement about that a few days later in a news program, and the next night I ended up making a statement again on the Laura Ingraham show on national news. And in that discussion, we also talked about, would there be any motivation or incentive to diagnose COVID-19? And I shared the information that the fact of the matter was that if it was a Medicare patient that was hospitalized or passed away, that the COVID-19 diagnosis on the discharge summary would call for higher payment. In other words, if you had a pneumonia that was just garden variety and you're in the hospital for 2 days or 4 days and you're a Medicare patient, Medicare pays a bundled amount. Whether you're in the hospital 2 or 4 days, the hospital generally will get a chunk of money. And with standard garden variety pneumonia, it'd be about $5,000. But if it was recorded as a respiratory infection, COVID-19, or pneumonia, COVID-19, then the hospital would get paid approximately $13,000. And if during the hospitalization a ventilator was used, that reimbursement would go to $39,000. So there was an incentive. I did not accuse anyone of fraudulently miscoding, but I think the public deserves to know the information, that there was a perverse incentive being created by some of the policy decisions. Fast forward, at the end of June, I was informed by the Minnesota Board of Medical Practice that I was being investigated. My license was being in question because I had been accused by anonymous complainants that, one, I had provided reckless advice because of my willingness to compare COVID-19 to influenza, which is something that Dr. Fauci and Dr. Robert Redfield, the head of the CDC, have done numerous times, as have many physicians around the country. And that was, I thought, a relatively silly issue, but it was an issue that I had to respond to. And then the other issue was that by questioning the completion of the death certificate and the Department of Health's communications, that I was spreading misinformation. I responded with a 8-page, 5,000-word letter and 70 pages of attachments, and those are available on internet. And a few weeks later, I received notification from the Board of Medical Practice that they had done a thorough investigation and had dismissed the allegations, and the matter was closed. I appreciate that very much. As a physician for 35 plus years, when someone goes after my medical license, it's no small thing. You're going after my livelihood. In a sense, you're going after my family, our reputation, the work we've tried to do, the people we've tried to help. I'll probably never know who my accusers were. But I think what they did was they were dissatisfied with the fact that I was willing to discuss a contrarian narrative, something that was outside their comfort zone. I get that. We're all having discomfort in this COVID-19 pandemic time. But I think what these people tried to do was weaponize the Minnesota Board of Medical Practice. They made that board their tool by which they could try to get at me, try to shut me up, try to distract me, try to make me feel bad, try to make me go curl up like a ball in a corner. I'm sorry. It didn't work out that way. I decided to go public with it because I think it's a public matter. I decided to be transparent, and so on July 5th I released a video telling the world that I was being investigated. And I had no idea that I really was telling the world. After some 20 million views and an awful lot of heartache, it was gratifying to receive from the Board of Medical Practice news of their dismissal of the allegations. But I will never forget this chapter of my life, and what an anonymous accuser can do, and how a board or an agency can be weaponized against you. And I believe firmly that if it can happen to me, it can happen to anybody. Anybody that has any kind of certificate, license, whether you're a hairstylist or a nurse or a teacher or whatever, if you have an agency or a board that you have to go to for periodic certification, someone can turn that against you. That's a problem.
So was the initial problem over hydroxychloroquine, or how deaths were calculated and the reimbursement? So $10,000 per death is a lot of money.
Well, this is for the whole hospitalization that we're talking. So the $5,000 for a garden variety pneumonia, $13,000 for a COVID-19 pneumonia. This could be covering the cost for the hospital of all the nursing, all the medications, whether or not it's telemetry is being used to monitor the patient's rhythm. So that's how hospitals get reimbursed from Medicare. But in terms of my complaints with the Board of Medical Practice, there was no direct link to hydroxychloroquine. The misinformation was related to the death certificate, and the reckless advice was related to my willingness to compare COVID-19 and influenza. In regards to hydroxychloroquine, I've spoken to the issue, but I haven't been, if you will, intricately involved with the investigations and studies being done with COVID-19 and hydroxychloroquine. I have exposure and a history of use in terms of prescribing hydroxychloroquine for 35 years. It's been on the World Health Organization's essential medication list for decades. It's been around for more than a half of a century. My wife has been on hydroxychloroquine for a type of arthritis that she has. But I have been disturbed immensely by what's happening regarding hydroxychloroquine. I think that the jury is still out in terms of whether or not hydroxychloroquine could be helpful at some point in time during the disease, COVID-19, or for some subset population. We don't know that. But what we have learned is that if you put hydroxychloroquine into the equation near the second or critical stage of the disease, it hasn't been effective, nor has anything else. We saw ventilators, which we thought might help. We saw the death rate going on ventilators go from 40%, which is typical if you go on a ventilator. 40% of our patients who go on ventilators will die, despite and outside of COVID-19. But with ventilators and COVID-19, in some centers in New York City, 40% didn't die, 80% died. So we know that ventilators don't do in that latter stage of disease what we'd hoped. And there's some studies that indicate that hydroxychloroquine doesn't. And fact of the matter is that critical second late stage of disease is still very much a mystery as to whether or not we're getting microvasculitides, whether or not we're getting small blood clots forming in the lung tissue itself and then more diffusely. But what we do know is that there have been multiple reports that used earlier in the disease, hydroxychloroquine may be helpful. And that we do know that dexamethasone and budesonide may be helping people. But what I don't understand is hydroxychloroquine costs maybe $10, $20 for a course of treatment. Remdesivir, which has been touted by Dr. Fauci, has never been approved by the FDA for anything. Initially, when COVID-19 hit, we thought maybe Tamiflu, it's also called oseltamivir, we thought that might be helpful, but it hasn't been. Tamiflu can shorten the disease of influenza. It can also provide prophylactic protection if used in advance of getting the disease. But that hasn't been helpful with COVID-19. But remdesivir is a first cousin of oseltamivir. And as such, there's a lot of interest. Could this be helpful? And the studies indicate that it may shorten the disease by 20%, but it isn't stopping the disease, and we don't have conclusive data that it reduces the number of deaths. But remdesivir is going to be more than $3,000 per patient. Hydroxychloroquine is $10 to $20. Budesonide and dexamethasone are relatively inexpensive steroids that we use through inhalation. Zithromax has been around for some time, and that also potentially could play a role, particularly in combination with, if you will, hydroxychloroquine and zinc. There are other things as well. Vitamin C, vitamin D, zinc, and magnesium have been found to be helpful.